Framtidsarenan. This is organized by RFSU, and I'm a senior policy advisor at RFSU, and my name is Ulrika Westerlund. The title of today's webinar is Corona, a crisis exploited by populists, and we're going to hear from activists from 3 different countries. It's going to be Georgia, Malta and Hungary to hear about what some of the consequences of the current health crisis has been for sexual and reproductive rights and health, and also LGBTI rights. First, a short round of introduction so that we know who is here. Sarah, would you please start?
Yes, thank you. I am Sara Österlund, and I also work as senior sexual reproductive health and rights advisor at RFSU, and I mainly work with issues related to global perspectives on SRHR and other international contexts.
Thank you.
Hi, I'm Lisa Caruana-Finkel, and I'm a founding member of Voice for Choice in Malta. Voice for Choice is the pro-choice coalition in Malta. We launched in March 2019, and we currently have 9 member organizations, including Women's Rights Foundation and Doctors for Choice Malta.
Erika, please.
Hello, thank you for giving me the opportunity and space for voicing problems of Georgia. I represent WISG, feminist women's rights organization working on empowerment, advocacy and visibility of LGBTQI people in Georgia. And we are working in 3 directions: community empowerment, advocacy direction, and communication and networking. Thank you.
Thank you.
And I am Tina Kolos-Orban from Hungary, representing Transvanilla Transgender Association, which is an organization working on trans rights and trans issues on the national level.
Thank you. Welcome, everyone. And we're going to start with a presentation by my colleague, Sarah, and then we're going to hear from all the 3 other activists. So please.
Just need to unmute myself. And so there, can you see my screen now? Ulrika, can you see the screen?
Yeah.
Okay, perfect. Thanks for this opportunity to say a few words around COVID-19 and the implications and challenges and a few opportunities related to sexual reproductive health and rights. So I make a very brief sort of global international overview. So I will start by mentioning a few very negative consequences when it comes to COVID-19 and sexual reproductive health and rights. And to start with, it's not, of course, the virus itself that causes these negative consequences, but it's the lockdowns, it's the restriction on social movements, on traveling, and also it's the reallocation of resources from sexual reproductive health and rights to the immediate responses to COVID-19. So some of the immediate negative consequences we saw after the virus started to spread around the globe, it was the lack of access to contraceptives, as in condoms and pills, and also in abortion medication. And this is, of course, partly due to factories having to shut down, for example, factories that produce condoms and not being able to ship condoms to other parts of the world. But it also has to do with the fact that in many cases, contraceptives is something that you get, and in many countries it's surrounded by taboos and stigma, and you get access to contraceptives through the physical meeting with a midwife or a doctor, and in no other ways. So when the social restrictions have come, people cannot meet their doctor or their midwife any longer, and they find no other ways to get access to contraceptives. We have seen interruptions in HIV testing and treatment from many parts of the world, and including because of reallocations of resources, again, that services are directed towards immediate response to COVID-19. We have seen reduced access to maternal health, safe delivery, reduced access to safe abortion services, if there ever was safe abortion services in the first place. I mean, in many countries there were no such opportunities to begin with, but that is something that has been reported from Europe and European countries and from many other parts of the world. And also from basically every corner of the world. And as a result, as a consequence of COVID-19, we see increased levels of sexual and gender-based violence. One reason for that being that, for example, women are forced to stay at home during lockdowns with a violent or abusive partner. Schools are closing, so there's no access to sexuality education in schools where there was sexuality education. As you know, in many schools there wasn't any in the first place. We have also seen authoritarian leaders and politicians taking the opportunity to use the crisis as an opportunity to introduce non-democratic discriminatory policies, including on safe abortion, including on LGBTIQ rights. And as a consequence, we also see a shrinking space for civil society and increased discrimination of already marginalized groups, such as LGBTQI populations of people. And although there is not yet any globally aggregated statistics altogether, these challenges and problems will result in, of course, unwanted pregnancies, an increase in unsafe abortions, maternal deaths, HIV prevalence going up, and also other cases of deaths and ill health as a consequence. If we look at the LGBT specific challenges or challenges and problems that are particularly difficult for LGBTQI persons, this would include, coming back to the issue on sexual and gender-based violence and increased levels of violence, domestic violence in general. Many LGBT persons find themselves forced to stay at home with hostile family members, which in turn, where there are reports on increased levels of violence and also, of course, mental ill health as a consequence. We see an increase in the lack of SRH services and therapists that can address the specific needs of LGBT persons. Not that there was a high, great access to start with, but it has decreased. The services have decreased even further in the context of COVID-19. We see, and this is also linked to what I previously said around authoritarian politicians and leaders taking the opportunity to impose and use the crisis for other purposes. So we see an increase in hate speech by politicians and religious leaders blaming LGBTQI people and persons for COVID-19. We see a decrease in the ability of LGBT organizations to do advocacy and just to operate, to exist. For trans persons, we see delayed or cancelled access to legal gender recognition procedures and transition-related medical care. And this is just a start of an even longer list, but to highlight some of the challenges that we can see at if we take an aggregated global overview. But then my colleagues and the presenters will go into much more interesting and interesting individual and country level cases. So if one wants to see some opportunities from an SRHR and non-discrimination perspective coming with COVID-19, one would be that there has been an increase in innovative models, not necessarily new, but innovative models of health service, including what we call telehealth, that is the use of technologies such as computer and mobile phones to provide access to health and health services. Either you can use it yourselves, or the doctors and nurses, midwives can use it. We see different ways of facilitating self-managed abortions, WED education opportunities around SRHR, and contraception being available without a prescription. We also see that there has been an increased visibility of groups that were already discriminated, and there is an increased understanding of the different needs and challenges and opportunities that different groups are facing, and that these needs have become more visible in the context of COVID-19. And this, of course, creates an opportunity to, in a new way, address the needs of already discriminated groups. And some would also argue that the crisis, as such crisis as COVID-19, is also an opportunity when it comes to economic and social changes, spread of new ideas. That is an opportunity to change harmful gender norms, deeply rooted harmful norms, as underlying causes of poverty and discrimination. I think that also can be an opportunity if we use it as an opportunity. I think the crisis and what is coming after COVID-19, as we build back better, can create such moments. Yes, I think that was all for the global overview.
Thank you very much. And when you remove your presentation, then Lisa can prepare to give us her intervention. So please.
Hello everyone, and thank you to Ulrika and RFSU for organizing this webinar. I will be speaking about the challenge of abortion access for women and pregnant people in Malta. And I will start by giving a general background of the situation in Malta, so that the impact of COVID-19 can be understood within this context. Malta has one of the most restrictive abortion laws in the world. Within the EU, it is the only country with a total legal ban. Anyone who has or assists with an abortion risks up to 3 years imprisonment, and there are harsher penalties for healthcare professionals. This criminalization of abortion has a chilling effect on women and healthcare professionals, potentially endangering people's lives. So many doctors in Malta are reluctant to give information about abortion out of fear of being criminalized, even though providing information is actually legal. And then women who may need medical attention post-abortion, even though this is rarely needed, may delay asking for help out of fear of potential legal repercussions. I would like to also point out that the situation in Malta is compounded by the immense stigma which is present in the country. And to make matters worse, there is also an anti-abortion organization that targets women with misinformation, deception, and coercion in order to prevent them from accessing abortions. But despite these unfavorable conditions, estimates suggest that each year over 500 people in Malta access abortions. And to put this into perspective, the population of Malta is less than 500,000. There are two main ways that people access abortions from Malta. First, there is a legal option, which is where people travel abroad to countries where abortion is legally available. Many travel to England, but people also travel to other European countries. And the second option is that they order medical abortion pills online, which is safe from reputable sources such as Women Help Women and Women on Web. But this option is illegal. Now, traveling abroad to have the abortion legal remits is never an option for everyone because of financial and mobility barriers for some. For those lacking financial means, Abortion Support Network, which is an organization based in England, has been providing financial assistance since early 2019. But there are other barriers to travel. So teenagers, people in abusive relationships, asylum seekers in detention centers, individuals with disability, and single mothers without access to childcare face additional obstacles, which might make it impossible for them to access this care abroad. The COVID-19 pandemic has highlighted the problem of lack of local access to abortions. To control the pandemic, Malta suspended inbound flights from the 21st of March, meaning that the only way for people in Malta to access legal abortions abroad is much more difficult now to access. In fact, these travel restrictions have led to a rise in the number of people reaching out to activist and abortion support groups, and an increase in the number of requests for abortion pills. The pandemic has also caused delays in people receiving this time-sensitive medication from reputable sources abroad. And this could be for a number of reasons, such as disruptions in the supply chain or postal services between countries. Unfortunately, a number of unverified and potentially unsafe online sources offering abortion pills in Malta were created in recent months. So it looks like the current crisis is being exploited for financial gain. The pandemic has not only increased the requests for medical abortion pills, but it is likely to have increased the number of abortions needed. And this is for a number of reasons, some of which were mentioned by Sarah earlier. And these are not exclusive to Malta. So shortage of contraceptives, rise in domestic violence incidents due to lockdown and self-isolation measures, and with that, increased reproductive coercion and rape. And also because of job loss and income insecurity, which may have an impact on decisions of whether to continue pregnancies. Lived experience from Malta during this pandemic has already started surfacing. For example, a woman who recently accessed medical abortion pills online recently shared her story anonymously. When she found out she was pregnant, she experienced extreme anxiety as well as denial. And in the time she waited for the medication to arrive from abroad, she searched online for herbal remedies and had daily suicidal thoughts. Another woman was unable to buy her usual contraception, was raped by her abusive partner, and this led to an unwanted pregnancy. So it was recently reported that women in Malta were unable to purchase their usual oral contraceptive pills. And apparently what happened was that at the beginning of the pandemic, the Maltese government ensured an extra stock of medicines to prevent shortages, but oral contraceptive pills were not included because they are not listed as essential medicines. The state of Malta's sexual and reproductive health and rights has been criticized by a number of international bodies over the last decade. And even during this pandemic, there have been many calls for action, including by the European Parliament and the Council of Europe's Commissioner for Human Rights. Yet, Malta's government has made no attempt to address and reform the country's restrictive abortion laws, or in any way try to facilitate access to abortion care abroad during this pandemic. Now, lockdown measures are being relaxed in many countries, and this includes Malta as well. And in fact, the airport is meant to reopen again in a few weeks on the 1st of July. But when the flights resume, things will just return to the way they were before COVID-19, so the problem itself will not be fixed. So we need to stop ignoring reality, and because we cannot continue relying on other countries to provide abortions for Maltese residents. And people in Malta cannot keep ordering medical abortion pills online whilst fearing legal action. So change is urgently needed. Abortion must be decriminalized, and it must be available and accessible locally. Abortion is essential healthcare, and it must be prioritized, both during this current COVID-19 pandemic and also beyond. Thank you.
Thank you very much. We will come back with questions and comments after all the presentations. So now over to Georgia and Eka, please.
Thank you very much. Well, I will speak regarding situation of LGBTQI people in Georgia. As unfortunately, the anti-crisis plan released by the Georgian authority regarding COVID-19 pandemic left numerous groups beyond the scope of state support, like precarious workers, self-employed persons, and the most affected are LGBTQI people who lived without any support, without work, and besides, as social distancing was offered by state, they left without even social support from surrounding. And unfortunately, they only depended on the support provided by numerous initiative groups or community-based organization, which is surely not enough on that regard. We were closely working with the community. We switched to emergency mode and starting monitoring and starting searching needs assessment on that. And we clearly seen that the demand of in first aid, like hygiene, food, and medicine increased triple even in April, and it continues increasing. We are receiving more and more new cases on that. What state done so far? They just released only 100 humanitarian kits for LGBTQI people, which is already distributed, and this is the only answer on this devastating situation. However, we continue working and demand from government to open their eyes and see this situation and elaborate some crisis plan, and we have good developments on that regard. Tomorrow we will have the first meeting with Interagency Committee to discuss anti-crisis plan addressing LGBTQI people's needs, and hopefully in long run we will improve situation on this regard. Also, the situation was worsened because of social attitudes, as homophobia in Georgia is very high. 87% of population are homophobic, and this situation is frequently speculated by different political forces to worsen the situation, and because of that, LGBTQI people stay the most marginalized group in our society, unfortunately. Also, I should say that this strategy on the first sight seeming quite effective, stay at home, do not see many vulnerable groups who do not have luxury of home to stay at. Also, they locked many women with their perpetrators at home. And recent research shows that in April, addressing domestic violence cases increased in 4 times. And I think it will worsen further and further, unfortunately. However, if we try to find opportunities in this, I believe that we can see the necessity of creating new alliances to combat the situation. Also, pandemic situation made it obvious for wider public how interconnected all segments of society are, and how different vulnerable groups found themselves facing similar problems and challenges. And I think that this is a time to start advocating for developing inclusive social policies and find some systemic solutions to change the situation with our community, and make our government to be more efficient, not to be blind to any of groups living in the state. So, thank you very much.
Thank you. Also, for you, we will come back with questions. So we're now moving to Hungary, and Tina, please.
Thank you, Ulrika. Excuse me, and thank you, RFSU, for organizing this webinar and bringing our stories from different countries together. As I will talk about trans issues, one would think that I will talk about different things, but I'm pretty sure that we are talking about the same thing, but disguised differently. And I would like to start with a short introduction on how the Hungarian government operates. Authoritarian leaders and governments were mentioned before by Sarah. And it's important for one who is not familiar with the Hungarian context to know that we have a government in the country since 2010 who has more than 2/3 of the seats in parliament, which means that they can vote whatever they want to. They have rewritten the constitution and all the laws in the country, basically, at the beginning. And this goes on. So whatever our prime minister decides to do, then he has an army in the parliament who votes for it. And the only important thing is that they preserve their 2.5 million voters amongst the 7.5 million voters in Hungary. And with that number, they can gain more than 2/3 of the seats in the parliament. One can call this a democracy, or one can say the rule of law and democracy is probably non-existent in our country anymore. But that is how it works and functions. And this government is measuring everything. And I'm pretty sure that other governments might use the same tools to decide on which part of gender they will have an attack on. Gender is sometimes described nowadays as a symbolic glue, which is kind of putting together the feminists, the LGBT, and the trans movement. And that's kind of up to governments to decide on which rights they can attack on. And the Hungarian government is really measuring on what is the target that they can attack so they don't lose their voters. But definitely the aim is the same, to have an attack on gender as such. And this attack on gender in Hungary has started many years ago. In Hungarian, we don't have separate words for sex and gender. We have the same word for all of them, for both. And in the past years, they have introduced in public discourse the word gender, which never existed in Hungarian, and usually used with negative connotations. So that's the thing. Then we had a word for transgender in Hungarian, which was using the same word which we use for sex and gender. But then they started to talk about, in Hungarian, transgender people, to put gender in our context, to kind of starting the scapegoating of trans people. And this word on gender has led to banning gender studies in the country. There can be no course named gender studies at universities, creating a huge fuss around it. Our very government, which is in power at the moment, have signed the Istanbul Convention, which is aiming to combat gender-based violence. So this government that we have today have signed this convention in 2014. And then these type of conventions have to be ratified by governments to be part of the national legislation. And we've been waiting for that ratification, and feminist groups and all other human rights groups in the country were demanding the country to sign this, to ratify the convention. This did not happen, but what has happened, COVID has arrived to the country and everyone was starting to prepare for isolation and for the pandemic. And the government just decided on 31st of March that they will ban legal gender recognition in the country. And they have introduced a law to parliament, which is aimed to register the birth sex of Hungarian citizens, which is not changeable anymore. And they define sex on very narrow biological traits, saying that is sex characteristics decided upon birth, and also it's about chromosomes. That's what they claim. And they say in the reasoning that biological sex cannot be changed. So at the end of the day, it's narrowed down to the chromosomes of the person, because we know that sex characteristics and external appearance can totally be changed. But anyway, they have introduced this legislation in the middle of the pandemic at the very end of March. And the final voting on this law proposal has happened on 19th of May, which is extraordinarily long time in the country, because this government is pushing through laws on parliament in 2 days. And guess what happened in between? On 4th of May, the government kind of realized that the Istanbul Convention, which they have signed before, is unconstitutional in Hungary and is talking about gender, and that's also about migrants. That's what they claim. And they decided, and they kind of made it public on 4th of May that they plan to reject it. And the next day, on 5th of May, the parliament has voted on the rejection of the Istanbul Convention. And the legislation on legal gender recognition was still pending. So we kind of spent all our time, and basically all the international actors here, like the European Union, Council of Europe, and the United Nations, has called upon the government to withdraw that piece of legislation, because that is literally taking away fundamental rights of transgender and intersex people in the country. And the government didn't listen to them. They kind of made it an even longer process. And on 19th of May, the parliament, of course, with no problem, have voted on the proposal, despite all the opposition were not in favor of what was proposed. And obviously, each and every actor who has raised their voice, they had to raise their voice in the middle of a pandemic. And each and every actor was blamed to not taking care of people dying in Hungary and not doing this in the middle of the pandemic, when the government intentionally introduced this piece of legislation just right in the middle of the COVID crisis. So I would be happy to talk about the similar issues that we have faced in Hungary and are facing in Hungary because of the COVID situation. But our government has measured that they can keep us busy with this. They cannot attack LGBT people in general because they know that there will be no support from society on that. They cannot attack abortion in Hungary because they know that is a no-go for them, because they will lose voters and they want to stay in power. So they found scapegoats in trans people at the moment. And Hungary became the very first country where legal gender recognition is basically banned by a law that is just non-existent in any legal system around the globe. And since then, we have seen similar, not samely severe attacks, but similar attacks in the UK, Kazakhstan, and recently in Romania on trans rights. And I just really wanted to highlight that it's right-wing religious groups behind and attacks on gender ideology. And this is the same thing that we observe in our different countries, disguised differently. But at the end of the day, vulnerable people are attacked by governments. That is my thing shortly. Thank you.
Thank you very much. And maybe all the panelists can come back and be prepared to answer some questions. And also, you're also very free to comment on each other, of course. But maybe we can start with discussing something that was touched upon in several presentations that maybe not all our listeners are familiar with this, the concept of Tina mentioned gender ideology or the anti-gender movement. And I'm assuming that you all have thoughts around this. Would you care to give us some more descriptions on how anti-gender movement operates in Hungary? You mentioned then not signing the Istanbul or ratifying the Istanbul Convention, for example, but what can it sound like in the debate, Tina?
So in Hungary, what was pretty interesting that amongst all this legislation pushed through, they've been not saying rude things about trans people. They've been not questioning trans identities, which is very interesting. Probably it's again, they have measured how they can present such a thing. So it was completely about biological sex being registered and kind of claiming that whatever gender anyone can have or whatever sex they identify with, that is biologically unchangeable. And all this discourse around gender is saying that it's an attack on conservative values, and there is a message that gender roles for men and women need to be preserved as they are. I cannot explain you what they mean by it, because obviously these are, family values are something we all agree with, I believe, but then we are attacked that we want to dismantle family values when we don't want to. And in different countries, it has rather different manifestations. I know in Hungary, these statements and remarks are pretty short and not discussed thoroughly in public, probably also because the public wouldn't buy that kind of discourse if it would be that long. So the simple messages, short messages without explanation can work. So that's what they use in their arguments, and it's mostly in the government. It's Christian Democratic politicians who are behind, and they have been leading also the attack on Istanbul Convention, the attack on trans rights. They've been presenting, they've been defending, and really short and simple messages, and not really discussed and explained thoroughly.
Thank you. Does anyone else want to comment? In Georgia, for example, what does it sound like there?
Yeah, I would like to comment definitely, because I think, unfortunately, Hungary is the illustration of the worst scenario to which Georgia could go directly if we can't succeed in the changes and in sustainability of the legislation harmonization. Yes, we have quite the same situation because our legislation is harmonized. We ratified even Istanbul Convention, and we are a very leader country in our region regarding that, but government do not nothing to reduce level of homophobia, transphobia, and biphobia, and worse, they try to often speculate with this issue to gain voters and etc. And it leads that we could not access our right, we could not use our right in real life, and all these rights stay on the paper, and if something goes wrong, we will be in the same situation as Hungary. And besides, in Georgia also there is no mechanism, there is no procedures regarding legal gender recognition, that trans people in Georgia are out of any scope, and we just currently have a case in Strasbourg court on this regard. We are suing our government to do something, because changing gender marker in ID documents, leading this rely on some sexologists or some psychologists who decided whether the person is true transsexual or not, and they made this person to go unwillingly under certain procedures on gender affirmation. So it's really devastating. Yeah, thank you.
Thank you. And Lisa, maybe you would like to comment on what the debate in Malta is like when it comes to the anti-gender rhetoric. Malta is a different context also. I think many people have noticed then that what is seen as a very big discrepancy on LGBTI rights versus then sexual and reproductive rights in Malta. So I don't know what the debate looks like in that regard in Malta.
So Malta does have legal gender recognition, and Malta is quite a pioneer in terms of LGBTIQ+ rights. But what I'd like to say about this is that what looks good on paper in legal terms does not necessarily reflect the social reality. And also, I'm not the best person to actually discuss about this particular topic. But yeah, many people are quite surprised when they see that the laws when it comes to LGBTIQ+ is quite progressive. But then when it comes to sexual and reproductive health and rights, it's really not. And I think this could be for a number of reasons, to be honest. But one of the things is that improvements in laws for LGBTIQ community might be seen by politicians as gaining them the trust and support of both the community and supporters of the community, without losing a substantial amount of votes. But the majority of the population in Malta does not agree with abortion, so most politicians see that as basically political suicide. The two main political parties in Malta have both said publicly that they are against abortion. And only recently, there's one politician who is an MEP said that he leans towards pro-choice. And other than that, most people, even if they, like most politicians, even if they are pro-choice, they might not want to show that publicly.
Thank you. And Sarah, I know that you have also looked at the gender movement and globally. I don't know if there is anything you want to add.
No, I think most has been well said already, but the whole anti-gender movement has become much more organized, and you can see that it's organized from the very global level to down to regional level, to national level, and even to local level. And what they all have in common is that they are against many things, against LGBTQI rights, against safe abortion, against women's rights, women's and girls' rights in many cases. And they are for the nuclear family, they are for traditional family values, whatever that is. But it's also interesting to see that there are several, although on the one hand, it's one movement, one anti-gender movement with many things in common, but you can also see splits and different subgroups. And one big divide is in between the group that is there, or actors that are there more for religious conservative reasons and ideological reasons, and the other groups, especially politicians, that are there more out of populistic, such as Trump kind of reasons, and for nation building you need to have something you are against and an outside enemy, and that's where LGBTIQ fits very well, or the feminist movement. So on the one hand it's one movement, on the other hand many movements within that anti-gender movement.
Thank you. I wanted to ask the people from you who represent particular countries, like what do you think, does your politicians, do they care about critique that come from other countries? Like you all mentioned kind of that your various countries have been criticized then for various things, abortion legislation or other things, and does that have any effect with international protests or challenges from the UN or whatever it can be? Maybe we can start with Hungary.
So far, we had the experience that the government might be convinced with international voices and international pressure, and they might try to keep things balanced. In this particular case, no pressure counted. The pressure was huge. It's still on, and it will stay on for sure. But it seems that at this moment, this didn't work, which is a very worrying sign, because that was the only hope we had up until now. So it's yet to be found out whether after some time it will have an effect. At the moment, it seems to be without any effect on what is happening.
Okay. Thank you. And Georgia?
Yeah. Though the Russian propaganda is very, very effective and very influenced in Georgia, we are surviving so far because of our willingness to join European neighborhood. So that is what keeps us from Russia's influence, and the international support is very important for us. Everything we achieve and everything we have now is because of that, because of sharp eye from international institutions, and because of willingness of our government to behave like European and Democrat state. So it is really very important. Yeah.
Thank you. And Malta?
Yeah, I mean, Malta has already been, has received criticism on the state of SRHR from international bodies over the last 10 years, from the United Nations Committee on the Elimination of Discrimination Against Women, from the United Nations Committee on the Rights of the Child, from the Council of Europe's Commissioner for Human Rights, from the European Parliament. I mean, and this kind of has, from like starting at 2010 until just, within the months of the COVID-19 pandemic. So there have already been international calls for change, but nothing has happened yet. But I think what I'd like to point out here is that there have been positive social legal changes in Malta in the last 10 years. If we look back and we see that divorce was introduced only as late as 2011, and you know, most countries have had divorce for like decades. The morning after pill was approved only in 2016, and in 2018 the Women's Rights Foundation was the first organization to take a public stand and say that they are pro-choice. So change obviously doesn't happen overnight, and we have had some positive changes over the years in terms of SRHR. And now we have Voice for Choice, the pro-choice coalition. So we are all working on trying to create change. And I think that there has already been a lot of progress. You know, some years ago, no one would even be discussing abortion openly. And now there's like articles in the media almost weekly, and people are becoming more comfortable with speaking about abortion, even saying that they are pro-choice, commenting on social media. So we are seeing positive change.
Thank you. We have just about 4 minutes left on this talk. So I think I want to turn to Sarah for maybe if you have some remarks on if you have seen any strategies from the SRHR community or LGBT community globally on how to try to improve the situation then also after, hopefully then, this pandemic. And then if you can keep your remarks to like a couple of minutes, and then all the rest of you can also just have some final comment. But Sarah, please.
I think one reflection when it comes to like the anti-gender movement, the anti-SRHR forces, anti-LGBTQI, anti-abortion. It is that I think we as, and this might be a bit provoking perhaps, but we as SRHR advocates, we have to be, we have worked a lot together with like-minded groups that believe in exactly the same things as we do, and we come to a certain, we get to a certain point, I believe, where we can't get any further in this very, very polarized climate, because it's not only that there is a very strong opposition to our issues, but it's also very, very polarized. It's becoming even more and more polarized. So personally, I believe in more dialogue, not necessarily with the craziest ones and those with the ugliest agendas, but those that are a bit in between, the movable middle, people that are not, that don't know, that are not aware, that don't have knowledge, that don't care, or states and governments that don't necessarily are against our issues, that don't stand up just because they are used to following Trump or US. So I believe we need to work as much as we need to continue standing up for our rights. We also need to work with new strategies and new ways of reaching out to new groups and make them understand what our agenda is all about. Thank you.
Thank you. Hungary, Tina?
I can only echo what Sarah have already said, and maybe just an addition that we all have to support each other when we are trying to widen our outreach, and we really have to listen. I think we have to listen also to the craziest ones, because we have to understand the circumstances we are acting in, and it's very important to listen to each other. If they are not listening to us, we can still listen to them, and we can try to speak to them too. And really, as Eka said before, that alliances are more important than ever, and we have to be allies, all of us, even if we don't understand, we are not on the same page regarding everything, but we can have a common ground. Then we have to stick together and talk to each other to show that even if we don't understand and agree on everything, we can talk to each other, and we might come to a point where we can agree on almost everything. So I mean, the feminist movement, the LGBT movement, the trans movement has to come together and talk over our issues and find other movements who can be our allies. That's very important.
Thank you. And Eka, Georgia?
Yeah. Yeah, thank you. Yeah, and I totally agree with both of you. And yes, it's really very important to struggle with polarization, because polarization let our governments do nothing for better lives. And it's very important to broadening networks and to create some network for solidarity and intersectional approach, and it will lead to sustainable and social changes in real lives, just not on legislational level. Thank you.
Thank you.
So obviously I agree with everything that has already been said. I think we need to continue raising awareness on the local situation, both within our own communities and also beyond. So I think events like this are a good way to do so. I think we need to continue collaborating also with other grassroots groups in other countries, and support and show solidarity within the international community. And as a last point, I think that politicians and policymakers must listen to activists and work with us on improving the situation and furthering human rights for all. Thanks.
Very good final words, and those will be the final words from this webinar. So thank you again for agreeing to participate in this discussion and presentation. And I know that we have seen lots of appreciative comments and likes on the Facebook event. And we hope that this reaches as many as possible. So thank you for today, and bye from us all. Bye.
Thank you.
Bye.
Bye. Thank you.
Thank you. Bye.
Thank you. Bye.
Thank you.